Hi everyone, welcome to Dr. Deepa's Learning Lounge. I'm Dr. Deepa and I'll discuss today a very interesting case. So this is the histopathological appearance of a patient who had arthroscopy showing dark brown pigmentation around the cartilage. This is ochronosis, which is a fascinating metabolic pigmentary disorder first described by Rudolf Virchow, who noted a characteristic ochre yellow appearance in the affected cartilage under the microscope. So it is most commonly associated with alkaptonuria, which is a rare autosomal recessive disorder caused by deficiency of the enzyme homogentisate oxidase. It is also called homogentisate 1,2-dioxygenase. So this enzyme primarily breaks down the homogentisic acid during the metabolism of phenylalanine and tyrosine. So when the enzyme is completely absent, the homogentisic acid accumulates in the body and it oxidizes, and that's what is the dark brown pigment that we are seeing right here. So usually these pigments deposit around the connective tissue. So clinically, the earliest clue may be the urine that darkens on standing, although many patients remain undiagnosed until adulthood. Over time, the pigment accumulates in the cartilage, the sclera, the skin, tendons, ligaments, and intervertebral discs also, most often in the weight-bearing areas. So they produce a classical bluish, brownish, blackish kind of a pigmentation. And these deposits weaken the connective tissue and they promote a chronic inflammation, like you're able to see in the slide here also. And eventually, there is a severe degenerating arthropathy that involves the spine, hips, knees, and shoulders. So from a pathologist perspective, the ochronosis has several striking microscopic features. Histologically, one sees a yellow-brown to brown-black pigment deposited within the cartilage. Collagen and elastic tissues are surrounding this area. The cartilage is often most dramatically affected, which shows a pigment around the chondrocytes, and there is fragmentation of the matrix right around, like we are seeing in these areas. So there is a loss of the normal architecture and there's a progressive degeneration. The synovial tissue may contain the pigment-laden macrophages and chronic inflammatory cells in some areas. In advanced lesions, there is associated calcification and osteoarthritic changes that may be very severe, incapacitating the patient in real life. So these changes can be present in variable quantity in each of the patient. One of the most important diagnostic clues is the presence of the brown blind pigment that is embedded within the connective tissue, particularly the cartilage, and the pigment is surrounded by the other areas which are present in the collective tissue. The history of a dark brown urine and degenerative joint disease should immediately raise a suspicion of ochronosis. Histochemical stains can further support the diagnosis as the pigment is typically negative for iron stain. If you're thinking of iron that can look similar, Prussian blue will be classically negative in ochronosis. That helps distinguish from hemosiderin deposition. Another additional diagnostic technique that can provide a valuable information is under polarized microscopy. The ochronotic pigment is generally non-birefringent. That helps us differentiate from other crystal deposition diseases also. Electron microscopy, generally these deposits are closely associated with collagen fibers, so electron dense deposits can be seen in electron microscopy. And there can be features of collagen degeneration also that can be shown in electron microscopy as well. And tissue fragility is even better appreciated in electron microscopy. So in summary, whenever a pathologist encounters a brown-black connective tissue pigment, cartilage involvement, pigment around the chondrocytes, negative iron staining, degenerative arthropathy, and a history of dark urine, ochronosis should be the highest suspicion among your differential diagnosis. Sometimes skin biopsy also can be seen in the taken in these patients, and the presence of banana-shaped dermal fibers can give an additional clue. So recognizing these characteristic features allows the pathologist to identify this rare metabolic disorder and contribute to the patient's diagnosis and management. So this is another differential. It is also ochronosis, but this is an exogenous ochronosis. This is caused usually by a prolonged exposure to hydroquinone containing skin lightening agents and other chemicals such as phenols and resosinols in as an occupational exposure. So what happens is they have a distinctive microscopic appearance very similar to the alkaptonuria. So the hallmark finding is again the presence of the banana shaped or crescent shaped ochre color pigmented fibers within the dermis. So this is highly suggestive of the diagnosis of an exogenous ochronosis. So for more such videos, stay tuned to Dr. Deepa's Learning Launch. So this is Dr. Deepa now signing off. I hope you like this video. So please log into www.drdeepaslearninglaunch.com for more such videos. Bye-bye.